According to the National Institutes of Health, more than 14 million Americans have been diagnosed with COPD, chronic obstructive pulmonary disease, and another 12 million likely have the disease and don't even know it.
COPD is an honest term for a couple of processes in the lungs. We lump chronic bronchitis and emphysema into that package because we don't know exactly at the time which disease it is, and they overlap a lot. And they have to do with airways and breathing. It has to deal with the inability to get air out of your lungs.
COPD is caused by progressive narrowing of the airways in the lungs. It occurs most often in people over 40 who are smokers or former smokers, and is the fourth leading cause of death in the United States, behind heart attack, cancer, and stroke.
The respiratory system takes in the entire environment, which would include dust, fumes, chemicals, animal danders, radioactive particles from potentially radon, or anything. And all that goes into the lungs. It's unmistakable. The lungs have defenses. The respiratory system has defenses and generally can take care of most of the insults that it gets every day. Smoking is one of those things that's a direct insult.
COPD develops slowly and can gradually worsen over time.
I either was going to smoke or I was going to breathe, and I couldn't do both. And so I decided that I wanted to breathe.
The symptoms of COPD should be described as a spectrum, from cough, shortness of breath, chest discomfort. Those symptoms progress to the point where your lifestyle becomes limited.
I think the first thing I noticed was that my stamina in exertion was decreasing considerably. I mean, noticeably to me. My little brother used to make fun of me when we would be out fishing at our camp, and I'd be walking up the hill, and I'd stop and look around, and he would say, "You're just trying to catch your breath." And of course I denied that, but the fact is he was right. And that was the first time that I really began to notice that there was an impact that was taking place.
Doctors perform a simple breathing test called spirometry to aid in diagnosis. The Global Initiative for Chronic Obstructive Lung Disease has categorized COPD patients into 4 categories in order to more accurately diagnose and treat the illness, from stage 1 or mild to stage 4, which is very severe. While COPD cannot be cured, it can be treated.
First and foremost, stop smoking, bronchodilators, antibiotics for exacerbations, oxygen therapy for those people that need it. The lung volume reduction surgery is an FDA-approved procedure.
An experimental treatment option that is not yet commercially available in the United States is showing promising conclusions in early clinical trials. ROX Medical is pioneering a new novel therapy to boost oxygen saturation in COPD patients. The ROX Medical Anastomotic Coupler System, or ACS, is intended for use in patients with stage 3 and stage 4 COPD. The goal of the ACS is increased cardiac output and improved oxygen delivery to tissue.
Most of the other therapies are aimed at changing the mechanical characteristics of the airways, reducing inflammation, controlling infection, things that are narrowly focused on the lungs. This therapy is really taking advantage of a cardiovascular phenomenon to improve cardiac function, improve exercise capacity in people who have abnormal lung disease.
I all of a sudden felt wonderful. It was like an epiphany. It was just, my attitude changed. I was much more positive. It was just a marvelous experience. And I haven't felt that good in years.
Highly oxygenated blood carried in the artery passes through the fistula and returns to the pulmonary system through the venous system. A 4-millimeter dilatation balloon dilates the portal site, and an arterial angiogram confirming coupler placement and fistula patency completes the ROX flow procedure.
The procedure itself is very straightforward. There are two parts: a right heart catheterization that allows us to measure the pressures inside the patient's lungs and determine if they're eligible to participate in the study. And the second part of the procedure, which is actually the implantation of the device. That part of the procedure takes about 20 minutes and the entire procedure less than 45 minutes, which compares quite well to most peripheral vascular interventional procedures that we engage in.
The ROX anastomotic coupling procedure is being performed in a clinical study in 9 sites in the U.S. with approval from the FDA.
Dr. Leeds and I are very excited about participating in the ROX Medical clinical study of an AV fistula for hypoxic COPD patients. Potentially, this procedure will allow patients who have very few alternatives to lead more functional lives.
ROX Medical's arteriovenous fistula was originally invented in 2004 by researchers at Stanford University. Since then, ROX Medical has conducted various clinical studies in Europe and Mexico with encouraging results. To learn more about COPD and this innovative treatment, visit roxmedical.com.